Interesting that only yesterday, in terms of the Global Competitiveness League table, South Africa and Africa scores quite highly on a number of indicators, but time and time again the two indicators that seem to be dragging Africa back are education and healthcare. So I think that the challenges are pretty large, but when one looks at globally how developing powerhouses in Asia or South America have started to grapple with their healthcare problems, it is possible to start to provide better healthcare, more healthcare, and to actually extend life to make the economy and society more healthy and also more productive.
And given that majority of African countries' tax bases are so weak, what options are available for governments in terms of funding public healthcare?
Well, that's a very, very good question indeed. As you well know, in many of the developed countries in Scandinavia and United Kingdom, they have tax rates of 60% and 50% respectively. I can tell you as an English person, sometimes that seems quite a large burden to shoulder. But that said, there are also developing countries, most notably in Asia, where they also have, relatively speaking, lower rates of taxation. What one finds globally is that the greater the economic prosperity of the country, that the greater numbers of a middle class. We know in the next 20 years in Africa, out of the 1 billion citizens, perhaps 125 to 150 million people could be considered to be middle class. They will start to produce more taxation, which in turn will produce more growth, and that in turn could be used to invest in healthcare. One of the biggest issues that any country or continent such as Africa faces is when to make these big investments in infrastructure, whether it's hospitals, schools, roads or railways, or dare I say it, the internet as well. So it can be done. It can't be done overnight. It usually takes about 10 years. The president in South Africa now is committed, I think, to creating a national insurance health system, and perhaps we can talk more about that as the interview develops.
And very often we've been told to look at Britain and Scandinavia as models. What lessons can we learn from the NHS?
Well, of course, to put it into context, the National Health Service in the UK was created immediately after the Second World War, back in 1948, when obviously our society was very much different to that society that we live in today. We have taxation rates between 25 and 50%. We spend in the UK about 8.9% of our GDP on health. In Scandinavia, they have taxation rates, as I mentioned, of up to 60%. They spend about 9.8 to 10% of their GDP. But you know what? In South Africa, you currently spend 9.8% of your GDP on health. It's just a small number of people spending the money on a small amount of quite good healthcare. The real trick now is to make that money work harder and smarter and actually make it work for the 44 million people that live in South Africa, for example. But the biggest issue I think we've learned from Scandinavia and the UK system is it does provide a very good safety net and a generally good level of healthcare for all of its citizens. But of course there are consequences of that. As you know now in the UK with the global recession, we're having to reduce our health expenditure by 15% or so. That is obviously causing problems, both in terms of with the trade unions and also the political debates within the various parties. So you might say that although the systems in Scandinavia and the UK are very good, there's an issue about how sustainable they are in terms of affordability. In Africa, you've got a different problem. You're rising from a much lower base, and basically your economic prosperity linked to your infrastructure, your natural resources, good governance and good commerce and industry will slowly but surely create the preconditions for greater investment in health. I would say one more thing on this. Africa as a continent doesn't have to follow in a linear fashion the development of Western or developed health systems. What I'm seeing in Asia and Latin America, people trying to leapfrog now in terms of their healthcare. And what I mean by that is, of course, you need more hospitals, but given that many people in Africa die of AIDS, TB and malaria, lots of the investment can go into primary and community services, and usually that's more cost effective and more clinically effective as well.